So we have already discussed about the Ridley-Joplin's classification, okay? But the Ridley-Joplin's classification, okay, classification can be used only when resource facilities are available. Only when the resource facilities are available, okay, then the Ridley-Joplin's classification can be used. So in the field, two other classifications are used. One is the Indian classification, okay, whereas second is the Madrid classification, okay. Now let us discuss about the Indian classification, okay. It is a clinico-bacterial classification. That means it is more clinical, okay. Clinico-bacterial classification, okay. According to the Indian classification, the leprosy is divided into the indeterminate type, tubercular type, borderline type, lepromatous type, and pure neurotic type, okay. So we can see a new classification system in the Indian classification, that is a pure neurotic type, okay. This pure neurotic type is absent in Ridley-Joplin's classification. In Ridley-Joplin's classification, we did not have pure neurotic type, okay. In Ridley-Joplin's classification, we used to have polar tuberculoid, borderline tuberculoid, mid borderline lepromatous, and polar lepromatous. So the pure neurotic type is only present in the Indian classification, So let us discuss what are these indeterminate type, tubercular type, borderline type, lepromatous type, and pure neurotic type. So among all these, we should remember the fact that the bacteriologically positive is only lepromatous type, So it is bacteriologically positive, okay. All are bacteriologically negative, bacteriologically negative, but the lepromatous type is bacteriologically positive. But a borderline can be bacteriologically positive or bacteriologically negative. The pure neurotic type is also bacteriologically negative. So only type which is bacteriologically positive is lepromatous type, but in borderline type also there can be bacteriologically positive also, okay, borderline type also. So let us discuss one by one all the types. First is the indeterminate type, okay. These denotes the only cases. These denotes the only cases with one or two vague means not clear, vague hypopigmented macules. These are the only cases in which there is one or two vague hypopigmented macules and definite sensory impairment, okay. And these cases are bacteriologically negative. We have already discussed that these cases are bacteriologically negative, okay. This is indeterminate type, okay. Second is the tubercular type. These denote those cases with one or two well defined lesions, okay. Here was vague, here is well-defined lesions, and these lesions can be flat or raised, okay, and there is also hypopigmented or erythematous, and these lesions are anesthetic, okay, and this is also bacteriologically negative. So indeterminate type is also bacteriologically negative. The tubercular type is also bacteriologically negative. Okay. Third type in the Indian classification is a borderline type. Okay. According to the borderline type, okay, this type denotes those cases with 4 or more lesions. Okay. These also can be flat or raised, well or ill-defined, hypopigmented or erythematous, because these are borderline, so these may show the features towards the tubercular type or the lepromatous type. So these can be well or ill-defined, flat or raised, hypopigmented or erythematous, and these are also, but we have already discussed that this can be bacteriologically variable, okay, and if these are not treated, they will progress to lepromatous type. Fourth classification is the lepromatous type. Okay, this type denotes those cases with diffuse infiltration, okay, or numerous flat or raised, poorly defined, as in the Ridley-Joplin classification. The lepromatous was poorly defined margin, okay, here also poorly defined, shiny, smooth, symmetrically distributed. We have already discussed also in the Ridley-Joplin classification that the lepromatous types are symmetrical, okay, symmetrically distributed lesions, okay, and these are bacteriologically positive. And a new classification, that is a classification which is not present in the Ridley-Joplin classification, is a pure nucleatic type. As the name implies, it is purely nucleatic. That means there is no skin involvement. Okay, that means this type denotes those cases of leprosy which show nerve involvement. There is nerve involvement. Okay, but do not show, do not have any skin lesion, and they are also bacteriologically negative. Okay, so this is the Indian classification. Okay, in the Madrid classification, is similar to the Indian classification. Okay, so let us see the Madrid classification. The Madrid classification, okay, categorizes the leprosy as indeterminate type. First is indeterminate, second is tuberculoid, flat or raised, borderline, and lepromatous. Okay, so the Madrid classification is similar to the Indian classification. All these four are also present in the Indian classification, but the fifth, that is a pure neurotype, is only present in the Indian classification. Okay, it is not present in the Madrid classification, it is not present in the Ridley and Joplin's classification. Okay, so the WHO classification. Now let us study about the WHO classification. Okay, so In 1981, the WHO study group on the chemotherapy of the leprosy for the control of programs classified the patient as having, okay, WHO classified the patient for chemotherapy for into two classification. That is, one is the multibacillary, second is the paucibacillary. Okay, now let us discuss about the differences between these two types of classification, multibacillary and paucibacillary. These two are classified according to degree of skin smear positivity. Okay, so in the multibacillary, more than 6 skin lesions are present. Okay, whereas in the paucibacillary, the skin lesions are only 1 to 5 skin lesions are present in the paucibacillary. As the name implies, the multi means more. Multibacillary means more bacilli. Okay, first difference. Second difference is the multibacillary. What are the Ridley-Joplin's classification that falls under the multibacillary? Okay, that is polar lepromatous. As the name supplies, it is multibacillary. That means what are the classifications in which there are more bacteria, more bacilli in the Ridley-Joplin's classification, that is polar lepromatous. We have already discussed that as we move from the tuberculoid pole to the lepromatous pole, the bacilli number increases. So the polar lepromatous, borderline lepromatous, and mid borderline. Okay, these three Ridley-Joplin's classification fall in the multibacillary, whereas in the paucibacillary, polar tuberculoid and borderline tuberculoid are placed, because we have already discussed in these two classifications. In the polar side of the tuberculoid, the bacilli number is less, so it is pauci, that is lesser number of bacilli. So polar tuberculoid and borderline tuberculoid are placed in the paucibacillary classification. Okay, third, okay, in the multibacillary classification, the treatment duration is 12 months, whereas in the paucibacillary it is 6 months. Okay, this we will discuss in detail when we will be discussing about the treatment. Okay, for multibacillary 12 months, 6 months, and follow up after the treatment. After treatment. Okay, in multibacillary, the patient should follow annually for 5 years. Okay, and in paucibacillary they should follow annually for 2 years. These also we will be discussing when we will be discussing about the treatment. Okay, so this classification is based on the fact that the protective immunity is inversely proportional to the number of lesions or number of body area affected. Okay, that means when the protective immunity is less, the skin lesions are more. That means in the multibacillary, the skin lesions are more because the protective immunity is less, or number of body organs affected are more. Whereas in the paucibacillary, the protective immunity is good. So that means the number of skin lesions are less, and the number of body organs affected, number of the body organs affected are also less. Okay, so this is the overview of the WHO classification for the chemotherapy. This classifies into the multivascular and the paucibacillary according to the degree of the skin smear positivity. Okay, thank you.